नमस्कार, यहाँहरु सबैजनालाई स्वागत छ। सब्स्टेन्स एब्युज अनि एल्कोहल युज सिक्किमको लागि एउटा ठूलो समस्या बन्दै गइरहेको छ। एभ्रीडे हामी न्यूज पेपर्स अनि डिजिटल मिडियामा पढ्ने गर्दछौँ केसेस रिलेटेड विथ सादा सब्स्टेन्स एब्युज एल्कोहल युज। र आज हामी यही कुरोलाई लिएर केही चर्चा परिचर्चा केही डिस्कसन गर्न लागिरहेका छौँ। सायद तपाईहरुलाई थाहा छैन होला, 2016 मा एउटा एनजीओ सिक्किममा गठन भएको थियो जसको नाम हो सिक्किम अगेन्स्ट एडिक्सन टुवर्ड्स हेल्दी इन्डिया, साथी। अनि यो एनजिओले सिक्किममा भएका जति पनि स्कुल स्टुडेन्ट्सहरू छ उहाँहरू बीच सब्स्टेन्स एब्युज अनि एल्कोहल युजलाई लिएर काम गरिरहेका छन्। र आज मसँग प्यानलिस्टहरू हुनुहुन्छ र उहाँहरूको इन्ट्रोडक्सन म तपाईहरुलाई गराउन लागिरहेको छु। सर्वप्रथम हामीसँग हुनुहुन्छ डाक्टर सत्यदीप एस छेत्री, हु इज द एसोसिएट प्रोफेसर इन केमिस्ट्री डिपार्टमेन्ट इन गभर्नमेन्ट कलेज तादुङ एन्ड हि इज अल्सो वान अफ द बोर्ड मेम्बर्स अफ साथी। र यसरी नै हामीसँग हुनुहुन्छ मिसेस छोरेन डेन्जोङपा एन्ड सी इज अ साथी टिचर कोअर्डिनेटर एन्ड सी टिचेस इन गभर्नमेन्ट सिनियर सेकेन्डरी स्कुल इन तादोङ। Similarly, we are also being joined by Mrs. Karma Doma Bhutia. She is also a SAATHI teacher coordinator and she represents Government Senior Secondary School West Point. र यसरी नै हामीसँग डिकिला भुटिया हुनुहुन्छ। डिकिला is one of the team members in SAATHI. दुईजना peer educator स्टुडेन्ट्सहरू हामीसँग हुनुहुन्छ, पेडेन लामु भुटिया एन्ड सी रिप्रेजेन्ट्स बृहस्पति परसाई सिनियर सेकेन्डरी स्कुल। र यसरी नै हामीसँग अर्को स्टुडेन्ट हुनुहुन्छ अनि उहाँ हुनुहुन्छ रोशनी छेत्री एन्ड सी कम्स फ्रम सिनियर सेकेन्डरी स्कुल रुमटेक अनि उहाँ पनि पेयर एडुकेटर हुनुहुन्छ। सबैजनालाई म वेलकम गर्न चाहन्छु है। लेट मी स्टार्ट विथ डाक्टर सत्यदीप छेत्री। एउटा आइडिया कन्सेप्चुलाइज भएको थियो 2016 मा है, बिकज एट द्याट पोइन्ट अफ टाइम इट वाज इन अ पिनाकल जब यो सब्स्टेन्स एब्युजको कुरा गर्दै थियौँ हामीले है। साथीको एक्चुअल मोडल के हो अनि वाइ वाज इट फर्मड?
Okay, so this whole program actually started from 2012. I mean, there was a group of youth who had come to visit our honorable MP, and I was also a part of that discussion. And the figures that were coming out were slightly dangerous for Sikkim. हाम्रो एउटा सानो population छ, एकदमै close knit एउटा society छ. So यो अलिकति बुझ्नुको लागि चाहिँ हामीले 2013 अर्ली 2013 मा एउटा ठुलो एउटा अधिवेशन राखेका थियौं र यसमा हामीले हेल्थ डिपार्टमेन्टदेखि लिएर people from Bangalore, from Delhi, lawyers, practitioners, NGOs, everyone came, academicians came, and then यो प्रोग्रामलाई हामी अब यो प्रब्लमलाई हामी बुझ्नु चाहेका थियौं। तर बुझ्दाखेरि चाहिँ के भयो भन्दाखेरि चाहिँ intervention had to be done. So SAATHI was formed, and in 2013 our honorable chief minister was very much happy with this whole program, and he took it under his shelter and he said that let's put it under the chief minister's self-empowerment and youth scheme. So this whole program started from there. We started with 2 schools to see whether we could make some, and we did not know how to go about, what to do, whom to talk. किनभने यो मोडलमा काम गरेको मान्छे एकदमै कम्ती रहेछ र जो पनि खाली रिहेबिलिटेसन तिर मात्रै गर्ने भनेको ड्यामेज भएपछि या त पुलिस एक्सनले मात्रै काम हुने, यो बीचमा चाहिँ कसरी चाहिँ प्रिभेन्सन एउटा फायर वालिङ नानीहरूलाई या हाम्रो सोसाइटीलाई फायर वालिङ गर्न सकिन्छ त्यो चाहिँ भएको थिएन। सो वी वेन्ट एन्ड came forward with this model which we now call the SAATHI model. त्यति बेला हामीले peer education model भन्थे, तर peer education model पछाडी बुझ्दै जाँदाखेरि चाहिँ युनाइटेड नेशन्स अफिस अफ ड्रग एन्ड क्राइमले पनि गरेको रहेछ। बट उनीहरूको मोडल चाहिँ काम गरेन। 2007 मा उनीहरूले स्टार्ट गरेको, 2007, 8, 9 सम्म उनीहरूले बन्द गर्यो। दे रोल्ड ब्याक द एन्टायर प्रोग्राम। बट what we found was our model was totally different. We were making peers among students, peers among teachers, peers among NGOs, peers. So we wanted to make everybody talk to each other, because this is a societal problem which has a big mental health, mancheko condition, mancheko society. So everything had to be knit together. Right. So that is what we do at SAATHI, is knitting, creating peer educators among teachers, among principals, among students, among society members, police. So everyone is on board now. And at least this is a start. Now we are looking forward of how we can now further more scale up, not only from schools, but now we want to go to colleges, We would like to go into the societies. We had one of the NGO meet last year, I remember, where all the NGOs who were working in rehab centers had come, and we heard stories. And these are stories which are important, because unless you hear and understand stories, you will not be able to make any positive intervention. So that is the SAATHI model, basically. I think we'll talk about it.
Definitely. And let me tell you, everyone, that there has been a success stories, and even there has been some challenges for SAATHI to basically operate in the intervention level when it comes to students. And teachers plays a very important role when it comes to SAATHI model implementation. Ma'am, let me ask you, you have been working as a, teacher, as a SAATHI coordinator. Tell us, is there any success story, or is there any testimony you would like to say on behalf of the students, since we have to maintain the anonymity of the students? I'm
going to talk about one particular case study. He happens to be clean for almost his third year now, and I can very proudly say and rightfully say that he will never take it again, because I've visited his family and talked with his parents. He's become, actually his father passed away a few months back also. Now he's more or less like the main man of the house, So he's become very responsible. So in that sense, I think that is a very, very successful case study I would like to talk about.
How do you first convince the students whenever you find them, they are involved in, what is the mechanism you follow? So,
okay, if I have to talk about this particular student, he used to be in front of the principal before the SAATHI also came, okay? So most of the time, there was always so he was always in front of because always in trouble. So then after that, we had the SAATHI thing, and then I realized that he needed a lot of counseling. Mm-hmm. So over a period of time, he started, I think, becoming very listening to me, and I think everything I said, he started listening. So when so by the time, it's not immediately, but over a period of time, I started counseling him. And then when I asked him one day, I'm going to take you to a place where I think you'll be, it's going to help you. So then he couldn't say no to me. So that's how I actually took him to the rehab, and things started getting better.
So far, katina students
in fact, we just took one yesterday also. So almost 11 students rehab ma gako. त्यहाँबाट चाहिँ 5 जना त एकदमै राम्रो भइरहेको छ. So like that, we have 1 or 2 cases where they have again relapsed. So we are again giving them, I think, talking to them. Maybe they need further help.
Ma'am, let me ask you, you come from West Point Senior Secondary School. So what kind of changes you have seen? Because this has been a grappling issues even in West Point School.
Before SAATHI came, actually, yo schoolharu sabaima yo काम त भइ नै रहेको हुन्छ. We try to help the students by counseling and this and that. But after SAATHI's come to our school, I think we officially started 2015, but it's officially हामीले properly start गरेर with the help of SAATHI members from the office. It's become more easier for us as teachers also, because SAATHI एउटा हामीले form गरेपछि चाहिँ the students, they also get a stand with the badges and the tie. They are more confident, they come forward, and they want to work, they want to become cleaner, and cleaner in the sense they don't want to fall into that category where they are यिनीहरूले खान्छ त्यसो गर्छ त्यो, they don't want to fall in that category. They want to come and के भन्नु, they want to help the friends. Through SAATHI, we have been able to do a lot of good work. Actually, good work भन्दाखेरि म्यामले भर्खर अहिले सक्सेस स्टोरिजको कुरा गर्नुभयो. त्यसरी नै SAATHI आएपछि चाहिँ we've also had some success stories in our school. The reaction of the teachers and the friends are different, because SAATHI ले चाहिँ हामीले चाहिँ स्कुलमा अलिकति we are trying to make everybody aware that the person who is in this addiction is not a sinner. Actually, he's just sick, and he'll he can be get cured. Because हामी एउटा सेन्टरमा गएको थियो र त्यहाँनिर एउटा सेन्टरको एकजना इन्चार्जले हामीलाई यसो भन्नुभएको थियो. I remember the lines. He said that there is no chemical solution for chemically dependent person. The solution is support, love and care from the whole society. And since we come from school, हाम्रो स्कुलमा साथी आएपछि चाहिँ we become more stronger. We feel like we have some power, you know. हामीलाई के यताउता हेल्प चाहिँदाखेरि पनि साथी अफिसबाट आइ नै रहेको छ र not only students, teachers, हामीले पनि एउटा we have a stand where we can all come together as one and work for the cause. In our school also, I think Saathis, after Saathis come, राम्रै भएको जस्तो लाग्छ हामीलाई पनि.
Yes. So let me ask Dikila, and Dikila moreover is like, you know, she is like, you know, taking care of the operation part of. So tell us like, you know, into how many schools you have started Saathi program. अनि जब तपाईहरुले फर्स्ट सुरु गर्नु भयो पाइलट प्रोजेक्ट है कुन स्कुलमा सुरु गर्नु भयो, and tell us, can you give us some data of like, you know, as of how many schools are there?
Starting we have started in the year 2013. It was started as a pilot project in Deral School and Tatung School. So after that 2016 मा चाहिँ हामीले 30 schools cover गर्यौं. Then 2017 मा 40 more. So April 2018 मा 30 schools चाहिँ cover गर्दा चाहिँ so total 100 schools we are covering. यो 100 schools मा चाहिँ junior high school plus secondary plus senior secondary नै डल्लै cover गरेको छ. Then operation part मा हेर्यो भने चाहिँ अब first हामीले चाहिँ we organize sensitization program for the principals so that they should know what Saathi is and the importance of Saathi. Then after that हामी teachers training organize गर्छ. त्यसमा चाहिँ टिचर्सहरुलाई हामीले मेन especially we focus on basic of counseling. Counseling अलिकति त्यो फर्स्ट लेभल अफ काउन्सिलिङ कसरी गर्नु त्यसमा अलिकति हामीले उनीहरुलाई त्यो कुराहरु सिकाउँछ. प्लस अलिकति त्यो सब्स्टेन्स एब्युज रिलेटेड त्यो बारेमा पनि उनीहरुलाई ट्रेनिङहरु दिन्छ. रिसेन्टली ओन्ली वी ह्याड अ ट्रेनिङ इन दिल्ली ओन्ली. त्यसमा चाहिँ टिचर्सहरुलाई हामीले मेन फोकस चाहिँ बेसिक अफ काउन्सिलिङमै गरेको थियो. सो किनभने उहाँहरुकै डिमान्ड थियो कि दे वान्टेड टु लर्न दिस त्यो फर्स्ट लेभल अफ काउन्सिलिङ कसरी गर्नु, स्कुलमा जुन चाहिँ केसेसहरु आउँछ कसरी ह्यान्डल गर्नु भनेर. देन टिचर्स ट्रेनिङको बादमा चाहिँ वी अर्गनाइज अफसाइट ट्रेनिङ क्याम्प फर द स्टुडेन्ट्स. स्कुल इटसेल्फ टिचर्स एन्ड दिस प्रिन्सिपल्स मिलेर नै उहाँले स्टुडेन्ट सेलेक्ट गर्नुहुन्छ. एउटा स्कुलबाट नर्मली 30 स्टुडेन्ट्स सेलेक्ट गरेर दे सेन्ड देम फर दिस अफसाइट क्याम्प. त्यसमा चाहिँ हामीले नानीहरूलाई नट ओन्ली अन त्यो सब्स्टेन्स एब्युज मात्रै नभएर त्यसमा लिगल एस्पेक्ट हुन्छ, मेडिकल एस्पेक्ट्सहरू हुन्छ त्यो सब्स्टेन्स एब्युजको. प्लस लाइफ स्किल ट्रेनिङ पनि दिन्छ विच इन्क्लुड्स टाइम म्यानेजमेन्ट, लिडरसिप स्किल्स, त्यो टिम बिल्डिङ एक्सर्साइजेसहरू प्लस कम्युनिकेसन स्किल्समा पनि वी गिभ देम अ ट्रेनिङ. देन आफ्टर द्याट दिस स्टुडेन्ट्स स्कुलमा गएर चाहिँ उनीहरू चाहिँ दे विल बी टर्म्ड एज अ पिओ एडुकेटर एन्ड दे विल वर्क रिगार्डिङ साथी एक्टिभिटी क्या. उनीहरूले काउन्सिलिङ गर्नु, आइडेन्टिफिकेसन गर्नु. देन अरू साथीहरू जो फर इक्जाम्पल स्कुलमा कोही इफ समबडी इज इन्टु दिस सब्स्टेन्सेस, अरू कोही उनीहरूलाई लाग्छ कि जसलाई हेल्प चाहिन्छ, सो दे आइडेन्टिफाई देम. अनि उनीहरूले साथी जो साथी टिचर कोअर्डिनेटर हुनुहुन्छ जस्तै म्यामहरूको उहाँहरूको हेल्प लिएर चाहिँ उनीहरूलाई काउन्सिलिङ गर्नु या उनीहरूलाई के हेल्प चाहिन्छ त्यस्तो गर्छ. त्यसको बादमा चाहिँ वी अर्गनाइज स्कुलमा पेरेन्टल काउन्सिलिङ प्रोग्राम जुन चाहिँ स्कुलकै मेम्बर्सहरूले गर्नुहुन्छ साथी टिमले, र कम्युनिटी आउटरिच प्रोग्राम. कम्युनिटी आउटरिच प्रोग्राममा चाहिँ एक्चुअली हामी स्कुलको वरिपरि जो क्लस्टर्समा हुनुहुन्छ, पुलिस भयो या त पञ्चायत भयो प्लस मेडिकल जो हुनुहुन्छ उहाँलाई पनि इन्भल्भ गरेर चाहिँ सबैलाई अवेर गर्नुको लागि लोकल पब्लिकलाई पनि एटलिस्ट थाहा होस् सब्स्टेन्स एब्युज के हो र एटलिस्ट कसरी ह्यान्डल गर्नु यसको बारेमा एटलिस्ट एभ्री वान सुड नो भन्ने चाहिँ हामीले चाहिँ वाट वी बिलिभ. देन चाहिँ अर्को जुन चाहिँ पेरेन्टल काउन्सिलिङ चाहिँ हामीले किन गर्छ भन्दा चाहिँ नानीहरूलाई सपोर्ट एटलिस्ट पेरेन्ट्सको रोल सबसे इम्पोर्टेन्ट हो जस्तो लाग्यो. फर इक्जाम्पल कोही नानी इफ ही अर सी इज इन्टु सब्स्टेन्स एब्युज देन उसलाई खालि टिचर्सको हेल्पले मात्रै या स्कुलको हेल्पले मात्रै केही गर्नु सक्दैन. पेरेन्ट्स इज भेरी इम्पोर्टेन्ट. पेरेन्ट्सको सपोर्ट बिना र एउटा उनीहरूको जुन चाहिँ केयर छ त्यो बिना चाहिँ आई डोन्ट थिङ्क कुनै पनि नानीहरू सुध्रिन सक्छ भनेर या राम्रो हुनसक्छ भनेर. सो आई थिङ्क पेरेन्ट्स, स्कुल्स एन्ड कम्युनिटी तिनजनै मिलेर चाहिँ एटलिस्ट हामीले नानीहरूको लाइफ केही गर्नुसक्छ, राम्रो गर्नुसक्छ भनेर. देन लेटर त्यसको बादमा हामी वी वान्टेड टु इन्भल्भ एसएमसी मेम्बर्स अल्सो. स्कुलको जो एसएमसी हुनुहुन्छ उहाँलाई पनि इन्भल्भ गरेर चाहिँ यो प्रोग्रामलाई अलिकति हामी अझै हामी बेसीले हामी अझै छुन सक्छ या रिच गर्नु सक्छ भनेर.
Coming back to Dr. Satyadeep Chhetri, what we see is like we lack a proper research and a data as of when it comes to, you know, the substance abuse. Basically, alcohol ko da hami paउने गर्दछ NHFS को सर्वेमा पनि. So two things like proper research on this issue, and second is what we talk about the teachers is like a voluntary service. You are coming like, you know, you are in this on the board due to your voluntary, like, you know, a consciential exercise, right? So how difficult it is for the teachers to, like, because I've seen, like, it would be somewhat extra burden for the teachers to involve, right? So somewhat we see, like, under compulsion teachers take up this initiative. So there are teachers like Karin ma'am and, like, Karma ma'am and Choden ma'am. So ke bhanna chahनुहुन्छ, what do you have to say?
Yes, it is when we do teachers counseling and parents principals workshop, we tell them that if you want to have a clean society, your mind has to be clean. If you want to be a good learner, the child has to be first ready for that.
Yes.
So basically it is there, but then this you cannot force it on anyone. So we also request the principals to depute such teachers who would be interested to be a part of it. And today I can proudly say that all our teacher coordinators are doing excellent job in their own little time that they have. Of course the school burden is there, but we have also requested principals to slightly decrease their burden in school so that they can do these activities, because this is a prime importance. If you have a healthy society, only then it can happen. I would just like to add what Dikila said, and in continuation to what I said, peer teachers, peer educators, once they go for training and etc., we wanted to make this model self-independent, self-sustainable. So nowadays, we have teachers training teachers. So slowly we are building our own capital out here, our own human capital out here. So now those who have gone to Delhi and done this training, we had doctors from AIMS and people who have really worked, Population Foundation of India, UNODC, all these people who train them, they come back and they actually become very good trainers. So we would like to see that after a few years, SAATHI should not be required in Sikkim.
Okay.
That is what our desire is. It's not like a company or an NGO which has to. Jundin hudaina, I would be happy if all the hospitals closed down. That means there is no disease. Your disease is baseline problem is there. So this year we are going on into an extensive baseline survey.
Okay.
So all our materials are done, all our questionnaires have been made. So we want to do a scientific research with a sample size, say about out of 100 schools, at least we would be covering 30 to 35 schools this year. And this will be a very good sample size and across Sikkim. So broadly you will have a fair idea of what it is. Just adding to not only drugs, alcohol is also a big problem in Sikkim. I recently, and I keep joking, in principals meet and this one, ki, "Are nani ko birthday sa ta kina raksi khawnu?" This is normal practice. You have Nani's first birthday and then everyone, father and mother is like drinking. So Nani learns that a birthday means you should celebrate with alcohol. So I happened to go to one birthday party a few days back and there was no alcohol being served. So I was so happy. So that is that's one positive thing that's happening. Let's not serve alcohol at least. Bia comes once in your lifetime, but birthday comes every year. So if every child in an basti starts celebrating birthday, and every household every day someone or the other will be having a Rakshi party, which is bad. So just that, keep making small changes here and there. We do hope that in the days to come this will add up, and a day will come when we won't need rehabs, we won't need SAATHI, we won't need this program. So that is my dream. One day it should move out, it should not be there.
Yes, absolutely. So let's come to the peer educators. You guys are the most important spinal cord, one of the spinal cord of the SAATHI model. Tell us, your experience, because you have been working with your friends, with your peers, right? Kasto experience cha tapaiko school ma?
Speaking personally, SAATHI has helped me achieve my self-confidence and as well as teamwork, because all of our peer educators, almost 30, we've been working as a team, and I appreciate the idea that choosing us as peer educators, because I believe that people of our age are students of our age are much more comfortable talking to us, instead of talking to teachers or parents and all. So they feel kind of free to share their problems with us. And what I realized within these 2 years is that even they want to come out of this thing, this drug and all. and all they need is a helping hand. So I feel happy that I am contributing, I am being a part of the SAATHI, and I am being able to help them.
Let me ask you, Pedin, I mean, like, you have been working with your friends, like basically who are into alcohol or maybe substance abuse. So what is the first reaction? Do they take you seriously initially? I mean, when you tell them about the SAATHI or about, like, counseling them?
They don't take us seriously. They say, like, don't, like, there are so many people changing, there are numbers of people doing all numbers of things in this world, you cannot change. But like, when I go and say them, like, let's try, then, like, they take it little bit, they take it seriously. Then
So what are the factors which really you think is like motivating them to, follow what you are saying, your counseling?
first, I personally, like, I met one guy who used to use the substances, and I was not too close with him. Like, I started with him as a friendship, so he was very close to me. I started to know what he's doing these days and what he's doing, where he's going for lunch breaks, and I, like, came to know, like, he's going to canteens for smoking. So, like, I asked him, why you smoke? Like, he said, like, I'm so much depressed. And I said, is this your problem? Just because you are sad and depressed, you are, like, you'll do this? I asked him. So he said, like, no, like, I have a habit, so I always smoke, so this is my routine. So I asked him, let's go for lunch, let's do this today, let's do that. Like, I made him involved in my thing. So slowly he started like not to take those things.
These are something like, testimonies which really encourages, like, SAATHI program, right? So tell us, what are the challenges now? SAATHI will be completing 2 years of its program. So challenges ahead.
Challenges. Before I tell the challenges, I would like to put on record to thank Titan and Social Justice Department, Welfare Department, and the Health Department. They've been big supporters, both financially and morally, and manpower-wise also. So the challenge, as I said, is when this fund stops coming in. Then what happens? So as I said, that I would like to see in a few years' time SAATHI close down, because I don't want to see. But at the same time, we have to keep it running. We have to keep it moving. A lot of activities happen because of a little funds or the training programs that we initiate. It takes a lot of manpower, and also financially, finance is also required. So basically, we are looking at a time when there will be a finance crunch. So we would like all the schools to become independent, self-sustaining models. We have our own resource persons, so in 3 years' time, nobody will have to go to Delhi. We have our own set of teachers and SAATHI staff who will be good enough to train people. Then we have a lot of good people in Manipal, and also in STNM hospital, and all the PHCs, in fact, who are very good trainers. So all these things will be taken on board. But yes, we're still connecting the dots. We're still trying to find out the time when these schools become self-sustaining. And the second is a very important role in running SAATHI in an institution is the role of the principal. So many of these, our 100 principals right now, they are all overcharged. I mean, they're charged to the program. But it also happens that some of them retire, some of them move out to, say, the department or in different organizations. And then what happens, So let's hope that such small things will not become a deterrent, and we can get over as it comes. We are waiting for more challenges to come in. But the challenges should not be increase in drug users, it should be decrease in drug users.
That's true. So ma'am, as a teacher, what do you feel like, what is the challenges for you to implement this program in school level? Teacher.
Challenges, where we can't say it's like 100% eradication. I think it's I cannot say it's going to be, it's a little bit impossible. But why? Because every time we feel that it's a little become, like now we are almost clean, then we have new students coming. So that's like, but the good thing is that we know exactly how many numbers are now there, who's taking. Before, it was not like that. If you had seen Tadung School some years back, it was not like that at all. It was like, we had like, almost, if you had to count in the senior section, almost like 60-70%, they were taking something. So in that sense, it's really come down. When now it's like say for example, yesterday we took one student to the rehab, right? So like that we have. It's just that the most difficult part, we know he's taking it. Sometimes the counseling also is not working. So then how to convince this kid to, that's the most, like in my years of, counseling and teaching, I've found convincing the student, like getting their trust and taking them to the counseling is the most difficult part. So that part is there, and sometimes we have like the total denial from the parents. So like that type of challenges are there, but then if you have to look at from how it was before and now, obviously the intake has really come down, So like that, there are challenges, of course, but that we can count the number of students now.
Yes, yes. Karma ma'am, any message you'd like to impart to the people who are watching right now? Anything?
Okay, as an individual, I would just like to say that we need to accept them in the society actually with love. Because normally people are like, those children who come back from the rehab, they are not accepted completely by the family or anybody in the society. It is always there, we don't, they are like taken as a different species actually. We need to accept them and we need to help them with love and care. That is all I have to say. And like I said before also, that there is no chemical solution for a chemical dependent person. Love and support is the solution. And through SAATHI, through the teachers of the school, through the peer educators, we are just trying to do that only. And I hope the society will also come and join hands with SAATHI.
Yeah, Timila, would you like to add anything more to it?
Actually, on behalf of SAATHI, we actually request everyone, especially all the teachers, even the communities also, principals also. So we need your support. Give the support bina, we won't be able to work. SAATHI won't be able to work. So SAATHI is there in the school, but SAATHI team la pani school ko pani त्यतिकै support चाहिन्छ, so that we can at least यो प्रोग्रामलाई अघि बढाउँ. ल अघि बढाउनु भन्दा पनि इम्पोर्टेन्ट नानीहरूलाई कसरी हेल्प गर्नु, those who really needs help के त्यसको लागि चाहिँ we really need support.
That is one. We also have a small fund for families who are not able to send their children to rehabs. We have a support mechanism from SAATHI. So if the child really needs it and his family cannot afford it, SAATHI will help in that. So okay, financing is health program. Number two is what Karma ma'am and Dikila has also been trying to say is there has been an acceptance in the society of drug users. I'll relate to you an incident. Last year we had all the NGOs who had come for working in this sector, and one of them said, सर एउटा साथीले चाहिँ के गर्यो भन्दाखेरि चाहिँ आजभन्दा 5 वर्ष अगाडि कुनै स्कुलमा एक्स ड्रग युजरले गएर एउटा टक दिन्छु नदेऊ भन्दाखेरि चाहिँ स्कुलले आज आउनुहोस् भोलि पर्सि आउनुहोस् भन्थ्यो अरे. अहिले त खादा लगाएर बोलाउँछन् अरे. As a resource person. So that is one thing that these NGOs also said, and that was very nice to hear, because the acceptance, social acceptance आइसक्यो कि यो चाहिँ mental health problem. This is it's, as she said, they are not sinners, they are not criminals, they are just there's a mental health problem basically for users. I'm not talking about peddlers, but for users, mainly for users.
Yes, absolutely. So as we wind this discussion, let me tell you that the intent or the intention of this discussion was to introduce you all with this beautiful initiative called SAATHI. And these are the people, and there are more people who have been selflessly working and contributing in making SAATHI more effective in the school level. So all they need is your support, and all they need is your encouragement. So let's have a closing remark from Dr. Satyadip Chhetri, and as we say goodbye.
So be with us. We all are SAATHI. That's why we call it SAATHI. So everyone's a SAATHI, and let's join hands to remove this menace from the society. Because your society is also my society. Your children is also my children. We all live together. Let's build a more resilient Sikkim and a more resilient India. Thank you.
Absolutely, and you can follow them in Facebook, and you do also have a website, www.saathi-sikkim.org. Thank you so much to all of you for being so patient and expressing your opinions, and we wish you all the best in the future. Thank you so much. This is NIRMAL signing off. Stay safe and say no to drugs.